Uterine transplantation or womb transplantation. Uterine transplantation is a potential therapeutic intervention for women with absolute uterine factor infertility, which is an infertility secondary to absence of the uterus or the presence of anatomically and physiologically dysfunctional uterus. Uterine transplantation provides such women a unique opportunity to experience their own menstruation and pregnancy. About 100 uterine transplants have been performed globally, including in India, with birth of about 23 babies. Dr. Mats Brandström from Sweden did the first successful uterine transplantation in 2012, and the first baby after uterine transplantation was born in 2014 through preterm caesarean delivery. Dr. Shailesh Puntam Baker performed the first uterine transplantation in India in 2017, and the baby girl was born in May 2018. Now, the indications of uterine transplantation. First, Mayer-Rokitansky-Kuster-Husser syndrome is the commonest indication. Second, women with past history of hysterectomy with no children. Third, Asherman's syndrome, who can undergo hysterectomy at same time. For female genital TB, it can be done, but results are poor. Fourth, male to female transgender women. Fifth, miscellaneous conditions like severe or complex congenital uterine anomalies, radiotherapy damage, complete androgen insensitivity syndrome. Now, the donors of uterine transplant. Living donors have been used in 80% cases, while deceased donors were used in rest 20% cases. The living donors undergoes routine investigations and processes like other solid organ donations, which include microbiological screening to avoid transmitting infections like HIV, hepatitis B, C, CMV, Epstein-Barr virus, syphilis, toxoplasma, human T-cell lymphotropic virus. In uterine transplant, the donor are also tested for cervical smear, human papilloma virus, sexually transmitted infections like chlamydia, gonorrhea, trichomoniasis, candida, and bacterial vaginosis. A transvaginal ultrasound is performed to exclude structural anomalies. MRI or CT angiography is done for assessing the calibre and patency of pelvic vessels needed for transplant. Most donors are first degree relatives, which also provides immunological benefit. It is better to avoid older donors who may have atherosclerotic pelvic vessels with poor results of uterine transplantation. Now, procedure. Uterine transplantation involves transplantation of uterus, cervix, cuff of vagina, surrounding ligaments and connective tissue, along with major blood vessels supplying and draining the uterus. The full-length uterine arteries and veins are taken, and they are joined with internal iliac artery and vein with large lumen to avoid vasoconstriction and rejection of graft. Now, the complications of uterine transplantation. First, rejection of graft. Second, vesicovaginal fistula. Third, vaginal stenosis. And fourth, infections. Thank you for listening. Thank you.